This presentation is about nuclear diagnostic tests. Our objectives will describe the uses of nuclear decay in diagnostic tests, including radioactive tracers, radiation therapy, and PET scans. Radioactive materials are used in a variety of medical diagnostic tests. These tests use radioactive tracers with short half-lives. We can detect the radioactive emissions outside of the body. The choice of tracer determines which organ or part of the body is targeted by the test. So chemical properties of isotopes are nearly identical to chemical properties of stable elements, and therefore they have the same reactions, and you can target the body or part of the body based on an element in a molecule and how it interacts with that organ. So for example, your bones interact with calcium. You can take radioactive calcium and you get more radiation signal coming from where calcium is currently depositing on the bones. So the picture on the left is from a person with Marie-Bamberger syndrome, which is a disease where sufferers' bones are growing lots and lots of spurs. All of those dots are where the bone is growing extra bits that shouldn't be there. Half-lives of medically useful radioisotopes are about hours, possibly days, and most are beta emitters. The fundamental challenge of these tests is that these materials disappear naturally, like they decay quickly. That's the whole point. So 90% of medical diagnostic tests actually use the same radioactive tracer, technetium-99. It has to be generated on site at hospitals with little nuclear reactors. So if they didn't do it this way, you couldn't do the tests because the material would have already decayed before you deployed it to where you need it. It's kind of a wild thought here. We have nuclear reactors in hospitals if they do nuclear tests like this. Hurts my head. PET scans, or positron emission tomography scans, are used to look at the brain. Recall that a positron is a particle with the same mass as an electron, but with a positive charge. It is a form of antimatter. Before a PET scan, a person is injected with sugar containing carbon-11, which is a positron emitter. So once a positron is emitted, it combines with electrons to make two gamma rays, which are 180 degrees apart. We can pinpoint exactly where in the body that matter-antimatter reaction took place by detecting the location of the gamma rays that are emitted over time. They're going to be 180 degrees apart. So if the emission is closer to the detector on one side than the other, we can calculate the location of the emission. In areas that are more active, we metabolize more sugar, and so the matter-antimatter signal comes more from those places. So here you can see that red indicates more emissions and blue indicates fewer emissions. These are scans that are a comparison between a normal brain and one with Alzheimer's disease. You can easily see that there's a drastic decrease in brain activity associated with Alzheimer's. Radiation therapy is another practical application of nuclear technology. Cancer cells are targeted with ionizing radiation that kills cells. Unfortunately, it is not very specific, and it kills both cancer cells and non-cancer cells alike. Because the cancerous cells are rapidly growing and we target them specifically, we kill more cancerous cells than non-cancerous cells. Now, there are two ways that this treatment is commonly delivered. So we can implant a radioactive material into a tumor and allow it to stay for a specified period of time and then remove it. This type of therapy uses alpha emitters with longer half-lives. How long? Longer than the radioactive tracers, but short enough for significant radiation release during treatment. Focused light beams that have ionizing radiation are also used to deliver radiation therapy. That is the method used in this picture. So there's an important concept here. The penetration depth, which is how far the radiation can travel in your tissues, depends on the type of electromagnetic radiation that we use. So common sources are X-rays and gamma rays. Light does not discriminate which cells it kills either, cancers versus non-cancers. So when you use light therapy, you try to put it just into the cancer cells, but some of it is going to penetrate into normal tissues. Anyway, radiation therapy causes people to get frail and susceptible to infection because it's killing so many useful cells along with the cancer. But, big but, with either technique, you already have cancer that's killing you. The chance of getting more cancer from ionizing radiation is relatively benign compared to a relatively imminent death. This is not a pleasant treatment course, but it does save people's lives. To summarize, radioactive elements can be used in medical diagnostic imaging. Isotopes are chosen because they can be made into something that can react in a part of the body and has a short half-life to limit radiation exposure. PET scans can document sugar consumption via positron emissions from C11. They are a matter-antimatter reaction with gamma rays, 2 of them coming out 180 degrees apart, which can easily be detected. Radiation therapy kills cells indiscriminately, both cancerous and non-cancerous alike. There are 2 main modes of delivery: alpha-emitting implants of radioactive material and ionizing light therapy, which the penetration depth determines what area you irradiate and also how many cancerous versus non-cancerous cells you kill.